Hello, everyone, and welcome to another episode of 9x90. Some of you know that I have a twin. Her name is Sarah. She is also blonde hair, blue-eyed Jew from New York City area, except her eye color is way cooler than mine. She has an amazing partner, and we have him on the show today. So I would like to introduce you to Alex Fair. He should have been a judge because of his last name just being epic. But instead, no. He works in medtech innovation, curing all these crazy things that I don't even understand. I'm just glad they're cured. But let's see. So he led the National Innovation Challenges sponsored by major institutions, including American Medical Association, GE, Aetna, and HHS, selecting top healthcare startups from thousands of applicants to transform patient care policy and infrastructure. And he is the founder of MedStartr. This platform is absolutely brilliant. Some of you know I have Molo9, and we have that elite startup toolkit that I make people go through before they can be introduced to my investors, because if they don't have the tenacity to go through it, they're not going to have the tenacity to grow their company into something meaningful. Alex has his own thing similar to this, but for picking winners in the medtech, health tech, biotech space. Absolutely brilliant. So the platform also includes a fund family. So where I take the top winners that I see from startups and I bring them on 9x90 to say, hey, check out this investment opportunity. Alex has it all internal. So his fund has this startup accelerator, and then they pick the winners and they finance them. So if you want to be financing those winners in the medtech and biotech space, you have to join his fund. The fund has helped launch and scale hundreds of high-impact healthcare startups, including Medable, Unite Us, Misfit Wearables, and Startup Health, driving widespread change across the healthcare ecosystem. Guys, this Jen is a maverick. Alex.
Wow, that's quite the intro, Addie. Thank you. And it's been wonderful getting to know you over the last couple of months. Contributing to your Titans, tools of marketing Titans is really just super fun, super fast. Yes. And so it's been wonderful getting to know you and Sarah and everybody in the network. So so we've had a really great time trying. I retired when I was 38, and I said, let me do something really meaningful. And so I started a meetup group. And then it turned into MedStartr.com, which was a really popular crowdfunding site when crowdfunding first came out in 2012. And then not long after that, GE comes to us and they say, hey, that thing where massive crowds validate which ideas are the most likely to be successful, we think that's a really great way for our $6 billion Healthy Imagination Fund to figure out which companies to work with, because our people in the back room are not so great at it because they're biased and what have you. So I would get thousands of people to come into and click on different ideas, and companies would get launched. And so the first crowd challenge we ran, they paid for it. HHS was the partner, Health and Human Services, now being run by Dr. Oz, I believe, or RFK Jr. So this organization, is the largest payer in the country for all healthcare. So they're looking for the best new idea for not curing, caring for people with cancer. They try to avoid the word cure, and so a company called Medable, got its first funding from it, and this is Michelle Longmire. It's now, I believe, $2.7 billion last time I looked in valuation, but they got their first $25,000 from our contest. So it took us a few years after that before we started actually investing and accelerating the teams that would do well in our contest. So we missed the boat with Medable and Unite Us and One Doc Way and all these great companies. Companies get bought right off of the website. Bausch and Lomb came in and they bought a company after being on the site for 4 days. So we noticed that we could drive not just funding, but also partnerships, traction, M&A, all kinds of things. And millions of people came to the site. We switched over to just doing challenges, just doing contests. So went away from crowdfunding, but still do what we call crowd validation. So yeah, it's been a really exciting time. We've been able to help thousands of new ideas, get out to market faster, find their customers and partners. Really great new ideas. I wish we could say we enabled more cures, and that's coming. As we get deeper into oncology and small molecules, I think we're going to be able to have more of an effect. But something like one of our companies is digital therapeutic, and it reduces the cost of care by 42%. And why? Because it keeps autoimmune attacks from happening. So yes, there are some real clinical therapeutic solutions. So yeah. So thanks for having me.
Yeah, of course. Glad to have you.
Oh, I should probably talk about the numbers that you mentioned. Yeah, I don't know how you feel about visuals, but I love visuals. So this is our performance for the last 6 years. So you can see that the IRR is 43%. The model really predicts really well for the first 2 years. So we'd be going up 199% those first couple of years. But then the things that happen to small companies, which we've been learning how to deal with, how to negotiate those situations and make sure the contracts and deals that they do make sense. So we've grown up a lot in the last 7 years while we've been doing this. And we've done, I don't know, about 15 times better than your average healthcare fund, especially in this time period. So we're pretty happy with that. Of course, past performance is not a predictor of.
Alex,
yes.
More than half our audience just listens. They don't see the video.
I see.
So do you want to tell those who are not watching
behind me is just,
what they should be knowing right now?
Oh, so the bottom line is we had about 44% IRR over the last 6 years. Our first fund did 199%, but then we rolled that into our second fund anyway. So now our third fund is just opening. Fourth one is starting to get some commitments. And the idea of the family of funds is that we'll bring 130 companies in, to the accelerator phase. Relatively small checks. And then about a third of those, in our experience, because we've done 19 deals with 12 companies. And so those companies, not all of them make it to the next level, but a third of them have done somewhere between 12 and 30x since we invested, which is a pretty high proportion.
Pause for 1 second. Your first fund, how much? What can we just? I just want to walk people through your track record for 2 seconds, because we're bringing them into the middle of the conversation and we should bring them to the start of the conversation. So your first fund, what was the size of the fund?
Oh, hold on. Using the term fund is a little generous. Okay, it was my own money. I formed it as a fund. I made 4 investments, not large investments, and then that went up about 3x in about 18 months, which calculated at about 199% IRR. But
okay, and how
to
much?
be completely frank, it was only $130,000. Okay.
So you took $130,000, you multiplied that, and then you started your second fund with that money.
No, that attracted 26 other investors, a couple $1 million.
And then what was the size of your second fund? How much did you guys invest, and how much did you exit at?
So we've had 2 exits so far from that fund. So our DPI is 24.5%. So we haven't returned all the money yet. It's only $3 million or $2.89 million. So it's now worth $9.25 million. So the MOIC on that, the net MOIC is only 3.6. But
so you tripled the money in how much time?
6 years.
Okay, and then you have your third fund that you're starting now.
Yeah, that's a $40 million total expected size. We've got good commitments. We're doing our first close this month, and it's starting the whole process again of starting the crowd challenges, starting to get companies in and move in that direction.
Okay, so your fund that you have right now, you're raising 40 million. You have the 26 investors from your prior fund who got first right of refusal to come in on this fund. So you have space for a few more checks.
Yes.
Maximum that they're allowed to invest, minimum that they're allowed to invest?
The maximum in this fund is 10 million. I mean, I'd like to keep it under 5. I don't, but the idea is that you can allocate into the fourth fund, which we expect to be taking the validated companies that we now have gotten to know for the first 6 to 18 months and have hit milestones. So founders that we know really well.
Okay, so with this next fund, the minimum check size that people can invest is $250,000 or 1 million.
Well, it depends if they're bringing a lot more to the table than just money, then they can go down a $250,000. But minimum we're thinking is $500,000.
Okay. And then the maximum they can invest is 5 million because you don't want more than 20% of your cap stack owned by any investor.
Yeah, I mean we would tell people to allocate into Fund 4 instead of Fund 3.
Yep. Okay. So, and then with this fund, you already have the startups that you've selected that you want to invest in because they went through your accelerator.
No, we have a number of warehouse deals that are new companies. The idea of this Fund 3 is to find 130 new companies ready for the accelerator, ready for our help, connecting them to our network and to our partners and to be incorporated into insurance plans and things like that. But a lot of it is packaging, teaching them, finding the missing pieces, helping them find the right people to do those roles, strategy, advising. So it's a 3-year in-person virtual program where we really get very embedded with the companies, even providing, we have a mentor network of over 1,200 really amazing people who are great at all sorts of things, from finance to medical device development to AI development. So we help them find the missing pieces, but also introduce them to the leaders at large health systems like, HCA or, Mount Sinai or Contra Costa. So a lot of our companies, we've been helping them with our business development group that's been bringing them into very large deals. So.
Okay, very cool. Very cool. All right, and then let's see. How does MedStartr consistently identify winners before the market catches on?
Yeah, that's definitely probably our secret sauce, if anything. And this is how we began. After running basically these programs for about 160 different partners, like as you mentioned, HHS and Takeda Pharmaceuticals and Aetna, GE, we had developed this algorithm. I had developed it with about 126 different data fields, and one data field might be something like we sent them 100 things to do, and we watched to see who actually did them, right? And we consider this as part of the grit metrics. Also, do they listen? Which, as you know, with founders, if they don't listen, then problems will come down the road. So we have a whole founder psychometric methodology that looks for ethics, honesty, grit, and things like that. But also, do they inspire people? So on the MedStartr.com site, there are 17 ways that people coming into the site can engage with the ideas. So it'll be the normal things like, follow, share. But there's also try, pilot, partner, mentor, join, invest. Okay. And then we credential everybody who comes to the site. So we know who they are. And if a medical student clicks on the pilot button, the metrics that show on the screen, because it's very gamified, might go up. But in truth, it goes down because the guy is a friend of the guy, who's so that's one of the ways we check for honesty. We look at the social graph, the metrics on who knows who, which is all, discoverable. So after doing this for, 10 years, we had this, algorithm we found it to be 22 times more predictive. So there's p-value 0.05 less than the teams that didn't win. So we basically just sliced off the top 3% based on the metrics, didn't do any due diligence, and it predicted an IRR somewhere between 187 and 244%. You'll appreciate this. I knew so little about venture funding at the time. The person who did the analysis tells me this, and he says, your IRR would have been X and Y. And I said, well, is that good? And what's IRR? So I know, right? So I went and read a few books and then started just trying it out myself, and then brought in, the LPs, and it's really been just fantastic. It's the best job in the world.
Yeah. Oh, so funny. Yeah. Well, I mean, usually when you get started down this path, you know a lot about one or two specific things, and then you find other people who know a lot about other specific things, and you kind of just pull top talent in to fill your weaknesses, right?
Well, we've taken that to an extreme. So everybody who comes into the site gets logs in with LinkedIn. They self-categorize in 77 categories, right? And then we watch what they do, and then we credential them if they actually click on anything, or even if they watch a video for more than 17 seconds. And so if Eric Topol comes in, and he has, he's probably one of the top guys in healthcare. And then he clicks on something and he runs the Scripps Transformational Institute, or somebody like Amy Gleason, who's now the head of Doge, acting administrator for Doge. She put her idea on MedStarter back in 2013 and raised funding, and then raised another 8 million or so, and that company did really well for a while. So the people who, if you're watching the video version of this, you'll see behind me a few of my favorite people from the MedStarter Mentor Network, which is over 1,200 healthcare innovation activists, leaders, friends, and guys like Tom Sang, who started Valera Health, which is one of our portfolio companies. He also wrote the High Tech Act, which
if you're not watching the video version of this, you can look at the show notes later, and we will have this presentation embedded.
Okay. So my point is that we have this very engaged audience, this group of people who are very interested in driving healthcare innovation. As you know, we also have a WhatsApp group, or actually about 97 of WhatsApp groups, all in different categories, hundreds of people talking all day long about Alzheimer's or AI in medicine, or the latest changes in HHS. I can't say specifically, but there's one member of government that seems to use us as her think tank. So she'll say, well, how do we do this better? And the 317 people in that particular group will say, well, you can do this, or I saw this, here's a great idea. And so a week later, an RFI comes out, and a lot of the ideas that were discussed in the salon, that's what we call it, and that's what the salon is for. It's just discussing ideas. And it started out as just a place for all of our MedStarter mentors to hang out and talk about, what's going on, and bang around ideas. And just like the salons of the 17th century, in Europe and India, everywhere, it's a place for ideas. And it's a place for things.
I think your WhatsApp groups are very, very cool. You have some very neat people in there. Like, for example, when I was launching my real estate fund, I posted in one of your groups, I said, hey, we need someone to interview my partner and I. And the Minister of Finance for Macedonia is in your WhatsApp group. And he reached out.
Really?
Yes. He reached out and he goes, hey, I'm the minister. He used to be. He was the Minister of Finance for Macedonia. It's like, I'm the Foreign Minister of Finance for Macedonia. Would you like me to conduct the interview? I know a thing or two about financial markets. And it was just like I told some of my friends, and they were like, this is unreal. And I was like, you have to meet Sarah and Alex. I have a very, my black book is stacked, but it's very private and very guarded, just because I've been stabbed in the back so many times. So I keep it like the ultra secret society you've seen in there. As soon as someone does something sketchy, I kick them out. I keep it super tight. We have a very small group in there. We have people from the Medici family, Guggenheim, Segar, Sats. We have power players in there, but it's a tight group. You have this huge community that has some crazy, equally powerful people in it.
Oh yeah, and we've been at this for years, but absolutely, Sarah Pistolnik and her network has been an amazing experience having them come in and become part of this. It's a merging of two communities, right? So I had millions of people come to our websites, and we collected thousands of the best. Right. I literally went through 15,000 people, and I selected 177 of them, February 16th last year. And I said, I want to talk to my friends. I haven't talked to them in a while, and I want to talk about ideas. So that's how that started. And we had a very tight control of who was coming in, very velvet ropes. And it was just what we called, okay, Sarah's going to hate me for this, but the freaks and friends, right? So, but so
Okay, you
I
guys
gave
have to know that Alex is very self-deprecating. He was like calling himself the most obnoxious person or something in his contribution in the book. And I was like, Alex, you're in my book because you're an industry titan. You can't be self-deprecating here. It doesn't translate to every country. And so we kept having to like delete these things for him. But
okay,
yeah.
so go read that chapter of the book. It's actually about being annoying, and it's about my mother's second last words to me. But we're not going to go into that story. Go read the book. Tools of Marketing Titans, available on all platforms. So
Not
page
call
396.
yourself annoying. He means
What's this?
relentless. I said, you can't just tell people that you're annoying. Like they don't understand the context. The audience is in 56 countries. So he's from New York. It's a
Okay.
completely different meaning. What he means is he's uncompromising with the level of quality he expects from himself, his portfolio companies, and those around him. So he says, look, he says to his followers and his friends, he says, I want to invite you to be annoying. I want to invite you to be uncompromising with the quality that you expect and the deliverables that you expect from yourself and from those around you. So it's a good thing when he's saying annoying.
Yeah, sure. Let's go with that answer. No. Yeah, so I am really persistent, and yes, I don't give up, and I'm on a mission, So, as a kid, everybody in my family had their own businesses. Some went public, bought by IBM, things like this, and so I went into like theoretical physics and went to cure cancer and went into pathology and a bunch of scientific papers. I was going to be a scientist, and I didn't believe in any of that business stuff, and that's annoying. And so this refers to my last conversation with my mom, and I started to apologize after she said that. Sorry, I was such a hard kid to raise, and then she comes out of her sedation and she's about to go to hospice, and she says, no, it was amazing, it was great, it was the most wonderful experience. And then she kind of trailed off because the sedation came back. I'm going to assume most wonderful experience of my life. So that's where that annoying story is from. But you're absolutely right, Addie. I definitely can be kind of hard on people, and I don't really pull punches. I tell people what they need to hear, not necessarily what they want to hear. Right?
But that's what makes the best results. Like I gave my pitch deck to one of my godfathers who's doing almost 200 billion worth of real estate projects in the next over the course of the next few years. And I said, I don't want you to be nice. I want you to rip it to shreds, because I would rather you rip it to shreds and I make something great than you be nice. I don't have the feedback I need in order to be great.
Absolutely. And people don't always take it well, but that, to me, that's a metric, right? So in addition to the online metrics that we collect, we then take the top 5 to 20 teams. We put them on stage at some big conference, put them in front of thousands of people, and we gauge the crowd as well, right? But we also fill the crowd, and we go out with them afterward. We call dinner with the winners, and we really get to know them well. And we fill the room with people like Sarah, like you, people who are going to be, that we trust, our MedStartr mentors, that then tell us, what they really think. Oh, in 3 years, this person's not going to listen to you, or something like that. And these are important things. And so, but when you're in real life with someone, you can't substitute for that. You can't just be a technocrat. You can't just do it on data. We found that you really have to go deep in the founder psychometrics and really sort of check off all the boxes. Are they, smart, able to listen, able to learn quickly, adapt, have a good moral code. Going back to the freaks and friends thing. So I gave a talk at Stanford in 2013, right before Vinod Khosla. It was standing room only. It was called Geek to Freak to Hero. And that describes a lot of these people, right? So the doctors and the patients, and the people inside big companies, they know something in great depth, right? Whether you're a cardiovascular surgeon or what have you. And then they get some idea that they could do something better. Maybe, like take Atul Gawande saying, I can do a checklist, to make sure that we don't make mistakes, right? And then in Atul's case, he went and he published it in the Atlantic. It's called the Checklist Manifesto. Got very famous for it. He does a lot of amazing things since then. But he was a freak initially, saying, well, cardiovascular surgery could be better if we only had a checklist, right? So, and everybody's like, hey, you're annoying a tool, right? So you become a freak to the people around you, and you quit your day job, right? And you just become a writer or what have you. Or in the case on MedStarter, they'll start some company. So a great example is this company called Canary that an anesthesiologist is sitting there and, monitoring a patient, making sure they don't die. And he says, well, it'd be really good if we had audio response in the OR. So I could have voice activated everything, right? And this is, 10 years ago. And now he's, doing a big deal with Microsoft or Amazon. And they're at the next level. And we've seen this happen thousands of times, that they get on the path and then they become strange. And then overnight, also known as 6 years later, they're a hero to millions of people. And it makes a difference in healthcare. And we've been seeing people, putting people on that path, helping them along that path. So when I call them the freaks and friends, it's because we are different.
Yeah. I think one of the greatest lessons you learn as an adult is how to make your unique differences an advantage rather than a liability. Because you spend all of grade school being told to fit in, do this test, get this mark, do this, do that, match everyone, wear a uniform. And then you get to adulthood and they're like, show me how you're different and what your competitive edge is. And you're like, what? So
you're into this box your whole life, and now, yes, show us how you can elbow your way out of that box. That's a very good example.
So then you're mislabeled as annoying when you should be labeled as innovative, forward-thinking, revolutionary, and all these other things.
Well, if you think about the education system, it really wasn't designed to create entrepreneurs.
No,
right?
It was designed to create employees.
Yeah, I mean, that's why, Zuckerberg, Jobs, Gates, they didn't finish school.
Yeah. Paul Hutchinson, I had him on the show today. He's he's a co-founder of Bridge Investment Group, which is now worth 50 billion in assets under management. He helped him to get the first 10 billion. He dropped out of college. The guy is a genius. Like, his brain just operates on another level. And it was like, this guy is so cool. Dropped out of college. He's like, I'm a college dropout. I shouldn't be here. I had to hire people with prestigious degrees because to do all these things. It was like, but yeah, school system is made to make employees.
And let's not even talk about PhD programs.
Oh yeah, because you dropped out of your PhD.
7 years of your life working for peanuts, and so I got 4.5 years into mine, and they said, well, okay, you need to switch labs, and I already had 5 scientific papers, and I'm just like, I'm ready to take my qualifying exam. I'm done, but they wanted another 3 years. I was like, you know what? I'll just go start a company. And I started a company, and it took off, and I sold it, and and haven't looked back.
Yeah.
So yeah.
So you walked us through the predictive algorithm behind MedStartr AI. You walked us through how you de-risk early stage healthcare investments. You started walking us through this, but I think dumb it down a little bit, because a lot of people are listening to this on their commute. So they need like clear step 1, step 2, step 3. What kind of track record have you seen from the startup supported by your platform, and what does it mean for the current fund's performance?
Yeah, we have learned a ton. So while we had 7 years of running the algorithm, and we had that preliminary data, when I first started investing, we had to learn about due diligence, and then we had to learn about the things that happen to small companies and small investors. And so being able to be there for them, to be their, what we call MVP, your MedStarter venture partners. So there were 3 of us, and we would divvy them up, and one of us would talk to the people, the CEO or the other leaders, every couple of weeks for years. And so always being there for that first call, was really important. So yes, so the algorithm predicts which companies to select. Then we're really good at going deep on the due diligence. Because remember, if we're only looking at 60 companies a year, getting about 1,000 applying every year, and we only did due diligence on about 60 a year, you get a lot more time to do due diligence. Whereas a typical fund, would be doing 4 meetings a day, and having analysts, go through and make books and things like that. And we do all those things, but we do it with much greater depth, right? And, we have the time to actually call and find out the references and get to know all the people and things like that. And we have so much, data going into it. It's a real competitive advantage. I don't like, playing roulette. I like, playing blackjack. Why? Because I can keep track of the numbers, depending on which is,
Yeah.
Sorry. Anyway, so I don't like
I do the same. Yeah. We all do.
So we have a ton of data, literally 1 million data points a month, on 100 to 120 companies, right? And then we pick which of those we're actually going to bring in and actually do the due diligence on. So that's steps 1 and 2. Okay, and then we do the deal, right? So our accelerator deal is we think it's the best in the industry, because it respects that they do need money, but we also need additional equity in exchange for our help. So they get $100,000 in cash, we get $150,000 in acceleration revenue, which is this is how accelerators work. And that helps us pay MedStarter mentors or our staff, or to run events, or to do promotional campaigns that will help these companies get where they need to go. And we are experts. Not only are we experts, we have some of the best experts in the world working with us, as well as an entire alumni network of people who have done amazing things with the help of MedStarter, which would include Sunny Vu, Amy Gleason, as previously mentioned, Fred Trotter, also now working at U.S. Digital Service, one of the best data activists in healthcare and policy experts. So the third step is really bringing in, the additional resources to the network, and that's all managed by the MVP, by the partner that's in charge of that company, that is going to represent them in all of our meetings, make sure that we have the updates and things like that. But even better, now we have this thing called Mission Control, which actually brings in all of the startups' data from their QuickBooks, from their CRM, from their CMS, the contract management system. And we have an AI overread of that data. So it actually helps the MVP know exactly what's happening. So if sales went down 20%, we might know before the startup knows. So we built a lot of tools and a lot of infrastructure around that, as well as the team and personnel who actually know what they're doing.
Okay, so what is the best way for prospective investors to get in touch with you?
We have many ways, but if you go to medstarter.vc today, or medstarter.capital is the next version that we're spinning up, because it's the new GP. There's an onboarding for LPs, and RFI, contact information. Those are probably best ways. If you want to go directly to me, I'm always alex@medstarter.com, medstartr.com. It's missing that last E. If you recall, back in the days of Tumblr, it was cool to not include the E. And now, if you type in MedStarter, it just goes to us anyway. So we never bothered getting that E. Maybe we should someday. I don't know.
Yeah. Okay. Very cool. Well, Alex, thank you so much for coming on the show. Sarah, thank you for making this happen.
I'm here.
Sarah is our token extrovert. She's the invisible hand that helps all of us to move. She got me on a prestigious panel. She got a bunch of her friends to be bestsellers in a book. So if you're wondering, you see all these people who are like ultra successful and you're wondering what that invisible thread is that holds all of us together, it's Sarah who's on the couch during this interview.
Her name is Sarah.
Her name is Sarah.
She gets me on really cool podcasts too.
And into books. Oh my God.
And into books, absolutely.
Yeah.
So, well, thank you so much, Addie.
Sarah's the reason that my book came out on time.
Yes, absolutely. She persistently, said, do this. She does that to me every day. So
she slept over and helped me negotiate 15 contracts in one day, which no one in their right mind would ever be able to do on their own without someone like Sarah sitting there on the couch saying, what do you need help with next? And giving you a pep talk every 4 seconds. So yes, she's the invisible force that has helped a lot of us to be very, very successful where we are. We love you.
I love you guys more than you can possibly imagine.
I'm male, so I have trouble expressing such emotions.
All right. Well, thank you so much for coming on the show. I will send this to you guys shortly. I'll see you back in New York.
Okay, thanks for having us.
Yeah, of course. Bye.
Bye.